I just posted a video a few minutes ago, but I got to thinking about a video that maybe I needed to make, a very brief video, on the topic of getting a vertical sleeve gastrectomy in Jakarta, Indonesia. My doctor was Dr. Handy Wing at the sleep center at Graha Kedoya Hospital in Kedoya, West Jakarta. It's a very nice, newer hospital. Some of the technology used may not be what you would see in the latest greatest hospitals in the West, but it's still very relevant modern equipment. The procedures are relatively up to speed, which you would see in the West. And the doctor's fantastic. Dr. Handy Wing, super nice guy. Not real talkative, but a really nice, helpful guy who seems to genuinely be concerned about your health and well-being, and doesn't make decisions for you. He asks and listens, and that's great because so often when I've dealt with professionals, a lot of times, and you get that with physicians, often you'll get that almost pushy. They're the doctor, you're not, and all that's a good thing. Sometimes it can be frustrating and provide a barrier, or keep it from being a simple solution. So it was a good experience. Really, an interesting aspect of it. I saw the earlier videos. I was really sore, painfully sore the first and second day. I'm not going to lie. They don't use morphine because morphine is not an option in Indonesia. It's a legal issue with opiates. So they use other painkillers, and they're effective at alleviating the majority of the severe pain. You do have a lot of discomfort, though, from the fact that your body is kind of freaking out about the fact that your stomach's not there anymore, at least not the way it's supposed to be. So it takes a day or so to adjust to that. And the first day, the Friday in the hospital, I slept almost the entire day. I didn't want to wake up. The second day, I felt a bit better. By the third day, I was good, and I could have gone home. I opted to stay an extra day, take an extra round of antibiotics and IV and extra vitamins, and I stayed in the VIP room, which was a single occupancy, just a regular nice single occupancy room like you'd have in America. It's not any real different than a single occupancy single room. There is a room above that's the presidential suite, or there's the VVIP room, which is nicer than the VIP, and then there's the presidential, which is above that, and those two are 2 million rupiah and I think 3 million rupiah, maybe, I may be wrong on that, respectively. That makes them about $250 to $300 in that range for those rooms per night. So that's not a lot of money for a hospital room. So at the end of the day, the total cost for the surgery with the the physician's fees not included, but all the hospital fees, all the equipment, all the medicines, everything was around 58 million rupiah. A little more than I anticipated. I was expecting a little less than that. But I stayed an extra day. I stayed in a nicer room. I could have gone to a double, two-bedroom. In Indonesia, they actually have 3-bed, 4-bed, and I think 6-bed rooms as well. So, but no, I could have gone to a 2-bed, if I would have wanted. But given that I'm an English speaker, and I would have probably been in the room with a native Indonesian or someone who speaks Bahasa. If there's people in there talking and there was a TV on and I just didn't understand it, I didn't turn the TV on the entire time I was in the hospital. Never turned it on. I was either sleeping or just on the internet on my phone, or something like that, talking to my wife. Never really felt like watching TV. So yeah, the cost, if you do the math, what is 58 million? That's roughly $4,000. With a one night shorter stay, you could take that down about $100. The doctor's fees would have increased that by about $500, so about 4,500. Still comes in being less than the price of going to Mexico and having it done. Now, granted, I don't know the difference in terms of the facilities. Mexico, I've heard, has fantastic hospitals. They do so many of those procedures. But if you're in Indonesia and it's you're thinking about having it done, now obviously you do any surgery at your own risk. You do any procedure at your own risk. This is not. I'm not telling you, that if you have a weight issue in Indonesia, you need to come do this. That you have to do this. I'm not saying that at all. What I am saying is that my experience with Dr. Handy at Geraha Kedoya was very positive, and I don't regret doing it, even though I haven't gotten to the point where I'm really losing a lot of weight yet. I'm confident I will, because it's only been a week, and I've lost 14 pounds in a week. I anticipate by Christmas being a different person, because I know how to eat right, I know how to exercise, and I'm going to. So, the question about, should I do this? I can't tell you if you should or not, but I can kind of give you my experience. And my experience is, I went to the doctor in America and had gallbladder surgery, and they did it as outpatient, and I was miserable. I went home, was miserable at home for a couple days. This was no worse, ultimately, than gallbladder surgery. And it should have been. And the first day was. The first day was just, it was pretty bad. But at the same time, when I had gallbladder surgery, I was so drugged up, so doped up that I slept for 2 days. Now I had it on Friday, and I went back to. I was taking grad school classes, and I went back to class on Monday for half a class, and I went home after an hour and a half as a block class, and so I can't. So what I'm saying is I don't regret it. I don't see the fact this is Indonesia being an obstacle. If you go into it with an open mind and with a little bit of preparation about things like getting up and walking to try to get rid of the gas from the procedure when they pump you full of gas for the laparoscopy, and a little bit of I mentioned in another video, I think that a spirometer, I had to ask for one. They had them. I just had to ask for it. They did have the devices on my legs to squeeze during surgery to help prevent blood clotting. After that, there was none. But at the same time, they may not have used it heavily, worried about that, because the anesthesia they used may have been different. They may not have, because the anesthetic had really no long-term effects on me. I had no, in the States, when I had my tonsils out when I was in my early 30s. That was a much worse surgery procedure. Much, much, much worse. The discomfort and pain level and long-term suffering caused by my tonsillectomy made this VSG procedure look like a walk in the park. So don't be deterred by the fact that it's in Indonesia. If you go into it educated and and knowing a little bit. I'm confident in Dr. Handy's abilities personally. For me personally, I can say that. If I was having another procedure done laparoscopically, I needed a surgeon, he's my guy. I wouldn't hesitate to recommend him. Although, again, I'm not telling you to go have surgery. You do it at your own risk. If you have a complication or a problem, that's you. My incision sites were clean. No infection, no discoloration, no bruising even. There was literally I've seen photographs of people whose abdomens look like they've been beaten up by Popeye and Bluto, and I didn't look like outside of the little small bandage like this with tape over it, you couldn't tell I even had a wound there. That was pretty impressive to me. When I had laparoscopic surgery previously for my gallbladder, the wounds were much worse, and I hear about the pain, the site where they remove your sleeve or your stomach from. There was no excessive pain there. They only used a 4-hole procedure instead of a 5 or 6. And they removed it from my navel rather than from my side, and no problems. It was really good. So again, hats off to Dr. Handy and the nurses at Geraha Kedoya. Thank you for your support and your kindness and just your overall experience. it was good. Could there have been some things improved? Yeah, yeah. It wasn't the Mayo Clinic. It wasn't going to one of the greatest hospitals in the West. But I've been to worse hospitals in terms of the general care and quality in America. Uh, when I had my tonsils out, that was much worse, and that was a supposedly good hospital in America. So, but again, if you have any questions, feel free to ask in the comment section, and I'll answer you back.